Hello and a warm welcome to our Facebook Live event with myself, Ashok Gupta from the Gupta Program. And it's wonderful that you're joining me here today to talk about a very important topic that hasn't really been covered by the mainstream media. And that is the topic of how chronic illness relates to COVID-19. And we'll be covering two topics today. The first topic is around, are we going to see a wave of ME, chronic fatigue syndrome, fibromyalgia, and other chronic illnesses as a result of the current pandemic? And the second topic we're going to cover later is around, if we already suffer from one of those illnesses, such as ME, fibro, are we more likely to have bad symptoms? Are we more likely to have serious complications? Are we more likely to be hospitalized? So we'll be covering those topics as well. Now, at the moment, the press is very much focused on the death rate, and rightly so. And we are taking either the illness seriously or not seriously based on the death rate in our local area or our country. And based on that, we're deciding, what our level of danger is. But in fact, something that's being missed is that there's lots of reports of people suffering from post-viral fatigue syndromes as a result of having the COVID-19 illness. And this isn't surprising. And let me just share with you some of the things that we've been researching and finding. So we found that, yes, there is some evidence that many people who perhaps survive the condition, perhaps they have it moderately or even severely, they survive it. But in fact, for many months, and obviously it's only been a couple of months since the first, 2 or 3 months since the main wave happened, that they still experience symptoms ongoing. So a world-leading infectious disease expert, the editor of the Cochrane report, Professor Paul Garner, he actually suffered from the illness himself. He had COVID-19, and he actually said, every day there has been extreme emotions, extreme fatigue. There's been something new each day, a muggy head, upset stomach, tinnitus, pins and needles, aching all over, breathlessness or dizziness. Okay. And some other reports show that even people with mild illness have experienced some longer lasting symptoms. So people have reported that a small percentage of people who perhaps were infected in February or March are still experiencing some fatigue, headaches, breathlessness, and problems concentrating or doing even light exercise. And for those people who suffer from ME and chronic fatigue syndrome, you'll certainly recognize some of those symptoms. And in Italy, director of the San Matteo Hospital in Pavia says, some of the longest suffering Italians are finding themselves in physical and financial uncertainty, unable to shake sickness and fatigue and get back to work. We've seen many cases in which people take a long, long time to recover. It's not the sickness that is lasting for 60 days, it's the convalescence or the period of recovery. It's a very long period. So I think that what I'd like to highlight today is that it's not just the risk or danger of passing away from this condition, but it's also the effects that it can have on us as individuals. And what I'd like to share with you is actually our model for how we look at why some of these illnesses turn into longer term issues, and share that with you so that if there are medical practitioners, doctors, or people who are suffering from the condition around you, you have some information that you can share with them. Okay. Now, what exactly is this coronavirus, this COVID-19? Well, it's a novel virus. It was only recognized last year, late last year. And it first of all infects generally the nose. And if our epithelial cells, our immune cells in our nose and the back of the nose are able to defend against the virus, then it can be fought off then and there. Then it travels down the back of our nasal cavity into our throat area. Okay. And once again, we have our immune system to fight it off at that location. And if our immune system isn't strong enough and we don't manage to fight it off, it then continues into our lungs. And that's when people experience more severe illness. And at that point in time, it's very interesting. People think that we're dying from the actual virus itself. But in fact, it's our own immune system response to the virus, which is making many patients pass away. And it is because of the pneumonia. So what happens is, our immune system over responds to the virus. Now, why would that be? Well, in our model, our whole body, our whole nervous system, our whole brain, everything about us is designed for survival. Yeah, survival of our genes, passing them on to the next generation. And so when our bodies and our brains experience a threat, the priority, the number one priority, is to defend against that virus and ensure survival, or that pathogen. So when it starts invading the lungs, the immune system goes into this hyper response. It believes that because I haven't been able to fight off this virus as it's transported down this respiratory tract, it's becoming more and more serious. Therefore, I need to unleash the best possible immune response that I can. I need to garner all the forces that I can to defend against it, because my priority is ensuring survival. And that's why we get something known as a cytokine storm, where these chemical messengers start informing the entire of the immune system to start fighting against the virus. But of course, when our bodies do that, it causes excess inflammation in our lungs and also around the body. So there's evidence of inflammation in the brain, there's evidence of inflammation in the liver, and also the kidneys. Okay. And as a result of that, that's where then we get severe inflammation of the lungs, pneumonia, and then the body finds it difficult to breathe. And this is especially so in certain types of patients who perhaps have a weak immune system. We also know that those people who are obese have a higher chance of complications occurring in those who smoke. Okay, so similar risk factors to general disease. And at that point in time, that's when the person's life is in danger, when we've got that cytokine storm and there's excess inflammation. Now, let's say someone recovers from that. There are two types of illness which may then still occur afterwards. Right? So the first illness may well be weakness in the lungs and in certain parts of the body as a result of the inflammation that occurred. So we call it acute respiratory distress syndrome. That's when this cytokine storm occurs and we get inflammation of the lungs and then potentially death. Now, at that point in time, those particular responses may have caused some scarring in the lungs, scarring in other parts of the body, which can then cause ongoing debilitating symptoms for people. Now, that's not what we're talking about here. That is something that happens also as a result of other illnesses. What we're talking about are the more moderate cases where actually there isn't necessarily any scarring in the lungs or any scarring in other parts of the body, but people are still experiencing what we call post-viral fatigue syndrome. Now, post-viral fatigue syndrome is when there's still a general weakness in the system. And why would that be? And it's still a mystery to researchers and doctors. And here at the Gupta Program, we have a model of what might be occurring. Essentially, when the brain goes into that hyper defense mode or hyper response mode, it has over triggered the immune system and also the nervous system. And we also experience severe emotions, and emotions are kind of protective stimuli to warn us against danger. Even once the condition is gone, even once the ARDS is gone, the COVID-19 has been fought off, the system may still be primed in that alert mode. It still may be primed to watch out, because if you've just been through a traumatic experience, just like war veterans experience trauma in battles or in foreign countries, when they come back, even though the war is over, that particular war veteran or that soldier can still experience severe panic attacks or anxiety. It's because the body still believes that we're in danger. And analogously to that, if there is trauma as an experience of going through COVID-19, the nervous system and the immune system stay in a traumatized state, a conditioned state. And therefore, any mild triggers, for instance, opportunistic infections in the body, perhaps some anxious experiences, perhaps the symptoms themselves of an overstimulated immune system, they become triggers for our own immune system to keep responding. So that means that even once the battle is over, the war has been won, our soldiers are still battling. Our immune system is still defending against that pathogen just in case. Yeah. The immune system always errs on the side of caution and says, my priority is survival. And if it means that I've got to be primed and ready to defend against the next wave of attackers, that's what I'm going to do. Because our immune system doesn't care about whether we feel healthy and strong. Our immune system cares about survival. That it is number one priority. And that may well explain why there are many patients who seem to be going on to develop post-viral syndromes. And those post-viral syndromes aren't formally diagnosed as chronic fatigue syndrome or ME until it's been at least 6 months of that experience, because we know many people experience post-viral fatigue as a result of many different illnesses, including flu. And so I'd like to offer that explanation so that it gives us a background and understanding for medical researchers, medical practitioners, but also for the general public, that this may be a mechanism via which there are those experiences of post-viral fatigue syndrome. Now, most importantly, what can we do about that? Why is the brain stuck in that loop? Well, for those of you who know and follow the Gupta program, we mentioned two brain structures specifically, the amygdala and the insula. Now, the amygdala's job is to protect us from physical dangers, but also it is involved in immune dangers. And the insula's job is to process the incoming stimuli from the body, see what the appropriate response is, whether that's an immune response or a physiological response, and then enact the correct response to ensure survival. And the insula is also involved in pain responses or moderating pain responses. So it's our almost like our sentinel that keeps a watch over the body and what's going on, and then protects us from dangers using the appropriate responses. Now, we know from animal studies, for instance, when we do rat studies, they find that if you give rats an immunosuppressant combined with sugary water, yeah, their immune systems are suppressed. Now, after a few rounds of doing that, they can give rats just the sweet water without the immunosuppressant. And guess what? Their immune systems still suppress themselves. The reason that is because the immune system will defend against anything which reminds it of the original events, the original illness. Okay, so that's why we know that these conditioning events occur in the amygdala and the insula, and that's been proven in animal studies. In order for those conditioning responses not to occur, what's incredibly important is if you yourself experience COVID-19 or someone around you experiences that kind of illness, the number one priority is boosting your immune system and taking rest. Okay. Now we live in a very macho culture right now, where when someone experiences illness, we've talked, oh, it's man flu. Let's just dismiss it. It's man flu. They're just away from the office because they think they're ill. And I really want us to take this illness seriously because of what we're seeing in the research. It clearly has a profound effect on the brain and the body. It clearly is offering certain post-viral syndromes in many patients. And therefore, if we do contract it, it is important that we do whatever we can to boost our immune system. Now, number one priority is not rushing back to work. Okay, so if you know people who've had it or who are experiencing certain relapses of what they think is the COVID-19, please do give them the advice to take as much rest as possible and only go back to work once they feel ready to do so. Okay, so that's the number one priority, is to take your time to get back to work if you've experienced it or someone you know has experienced it. And secondly, we know that there are certain things you can do to lower that immune over response or to modulate or moderate that response. Number one are things like meditation. Okay, so we know that whether you want to call it meditation or deep relaxation exercises, anything that really triggers your parasympathetic nervous system has the ability to calm that overactive immune response. So we know that meditation switches off about 30 or 40 genes that are involved in those immune responses. So something like that can really, really help someone recover much better. And of course, there are changes to your diet that you can make as well, and we'll talk about that a bit later. We also, and for those of us who have experienced ME and chronic fatigue syndrome, it's also important not to exercise. You can't exercise your way out of post-viral fatigue syndrome. And that's why people who've experienced it and who perhaps don't know what to do are often trying to go to the gym or exercise to try and feel better. But that will only make things worse, because it will tell your amygdala and your insula, those parts of the brain, that you're still in danger, and therefore, why are you exercising? You need to rest. So our immune system also gives us triggers to make sure that we rest as well. And really, it's about making sure that if we're experiencing those post-viral fatigue syndrome, even as a result of flu, or as I said, as a result of COVID-19, we do whatever we can to deeply rest, even if it's bed rest, even if it's meditating regularly and deeply. All of these things can support the rebalancing of our immune system and bring us back to that stillness. And if we don't, what can then happen, and this is what we're trying to prevent here at the clinic, there could be another wave of ME, chronic fatigue syndrome, and fibromyalgia from patients that in those first few months after having the condition, especially those few weeks after having the COVID-19, they're not resting. They're not deeply rejuvenating their mind and body. Yeah. And that's why we think this is such important information to get out there. So please do share this with your family and friends. And if you're on Facebook or you're joining us on Instagram, please do share this particular video on your newsfeed. So I'd love for you to, you can just click under the video, click the share, and share it on your timeline. You perhaps might share it on support groups or advocacy groups for COVID-19 or other chronic illnesses. And let's get this information out there, because it could be life-saving information. And even if it's not life-saving information, it can be information that prevents chronic illness from occurring in people around us. Okay, very, very important. Okay, so that is, I'm not sugarcoating it. I'm not saying, no, I'm sure everything will be fine. I'm clearly stating here that there is a strong chance that we will see a lot more people suffering from these chronic illnesses as a result of contracting COVID-19. And just like any trauma that our mind experiences or our physical body experiences, once we experience that trauma, that deep calming of the nervous system and of the immune system and rebalancing in those few weeks and months after we experience that insult, those are the most important to be able to prevent long-term illness. And we see this in animal studies, we see this in trauma studies as well. Okay, so that's the first topic that I wanted to cover today. And the second topic is what happens if you already experience ME, chronic fatigue syndrome, fibromyalgia, chemical sensitivities, POTS, or other kind of chronic illness like irritable bowel syndrome. Are you at greater risk of getting the illness? Are you at greater risk of having complications or even death? Now, the first thing is, we do know, in terms of, let's start with the kind of, I suppose, the negative aspect of it first. We know that people with these conditions have compromised immune systems because of the overstimulation of the immune system. So the NK cells, what we call the natural killer cells that fight off pathogens, we know that their cytotoxicity, so their ability to fight off pathogens, is compromised. We know that there's a lot of sympathetic nervous system activity in patients with these conditions. So an overactive stress system, which can cause what we call Th2 dominance. So in our immune system, we have Th1 dominance and Th2 dominance. Th1 is when we're fighting off physical pathogens, and Th2 is a general inflammation when we're fighting off infections. And that general inflammation is often active in these patients. And that can mean that, yes, our immune system may be compromised in its ability to handle the COVID-19 virus. And I say could, because there's no objective evidence yet. Then, of course, many people with these conditions experience sleep deprivation, and we know that sleep deprivation can compromise the effectiveness of the immune system. Then in terms of exercise, many patients aren't having the chance right now to exercise because of post-exertional malaise. So that can impact on the immune system. And there's various other symptoms that people have, which could be a risk factor. Now, the good news is, certainly when I've networked with many of my colleagues in the ME and chronic fatigue syndrome area, also reading the research studies, as yet, we have no evidence that people with those chronic conditions have a higher chance of getting the infection or a higher chance indeed of having complications. So there's no evidence as yet. And this is also backed up by the fact that certainly amongst our patient cohort, we don't necessarily find that more people are contracting severe flu or passing away from severe flu as a result of having these illnesses. And certainly there's no record of that. I think it would have been picked up by various doctors if that had been the case. Now, why could that be? Well, although the immune system is compromised in ME/CFS and fibromyalgia, at the same time, as we've said, that immune system may be overactive. So one hypothesis is that as a result of this overactive immune system, we're already primed and ready to recognize those pathogens circulating in the body. You know, there's already perhaps more of these cells circulating. You know, now it's a mixed bag because the research, there's certain aspects of the immune system which are overstimulated and overactive, but there are also certain aspects of the immune system which are compromised. Secondly, we know that patients with these conditions have often quite a number of opportunistic infections in the blood and in the body. And therefore, we know that there's evidence of ongoing infection and evidence that these are being successfully fought off. Okay. So I think that the jury's out as to whether patients with these chronic conditions have a higher chance of complications. But what I would like you to do is really take those precautions. Okay, so prioritize the precautions that you need to take. So that is making sure that you're isolating and away from potential dangers as much as possible. Having home deliveries instead of going out. Yeah. Making sure that if you do go out, that you wear a face mask in public indoor areas. And hand washing and all the things that we already know that I don't need to cover here. But please do take those precautions as much as possible to prevent your exposure to that. And once again, if you do that, we know that your chances of being infected are very, very low if you successfully, personally self-isolate. Secondly, I'd love for you to boost your immune system as much as possible. And as many of you know, we have something called the Coronavirus Challenge, which is a 10-day challenge to boost your immune system using the latest science and the latest research that we've done here at the clinic, based on our 20 years of research, in fact. And we're getting some fantastic reviews in terms of people's experiences of going through that. So you can take the Coronavirus Challenge at www.thecoronaviruschallenge.com. And once you sign up, it's completely free and not for profit. You'll find videos on our MEND protocol. M stands for the mind. E stands for energizing the body and exercise. N stands for nighttime routine, sleep. D stands for diet. And those are the four main components, our four main lifestyle components that determine our chances of getting a virus, our chances of cancer or heart disease, is all encoded within those four aspects, the MEND protocol, M-E-N-D. So when we're looking at the mind, we know that actually people who meditate can halve their chances of getting a virus. That's how powerful meditation is. And we also know that if they do get a virus, they can once again halve the number of days with that virus. So people are touting the benefits of these various antiviral drugs like remdesivir and all these other things. Whereas actually we already know that regular meditation has no obvious side effects generally in the population. And yet it also can reduce, if not halve, the number of days that we have a chronic virus, or certainly flus and colds. It hasn't obviously been tested yet on COVID-19. So the mind aspect is really making sure we meditate regularly. And by the way, I know some of you have questions. So at 5:30 today UK time, which is 12:30 New York Eastern time, we'll be stopping this particular Facebook Live and we'll be doing another Facebook Live with a Q&A. So we'll be able to ask questions related to these topic areas. Okay, so we're doing that in 5 minutes on the same page. Okay, so M stands for mind, regular meditation. The second thing with mind is reducing our anxiety as much as possible. And I do suspect that people's cases with these conditions have been worse because there is a fear of getting the COVID-19 virus. Whether that be our kind of anticipation of getting the condition and how bad it might be. Once we do have it, that fear of what effect it will have on us, that fear can instantly reduce the effectiveness of our immune system. So we want to be less anxious. And you might say, well, that's easy, Ashok. How do we become less anxious? Well, once again, within The Coronavirus Challenge, if you take that program, there's lots of opportunities there to actually find out how we can reduce our anxiety, and lots of tools and techniques and exercises. So we don't just give you the information, we actually give you the practical steps that you can take. And if you do suffer from severe anxiety, or you suffer from ME, chronic fatigue syndrome, fibromyalgia, as we know, we do have our more comprehensive brain retraining program called the Gupta Program, which is also available for those of you who have that severe anxiety or these chronic conditions. And at the moment, we have a special code. The code is PEACE, and if you use the code PEACE, you get 15% off the Gupta Program right now. Okay, so M for mind is reducing our anxiety, regular meditation, calming our nervous system, and reducing stress as much as possible. E stands for exercise. Now, many of us who have chronic conditions, we can't exercise. And therefore, I understand that you may well not be able to exercise, in which case, just some very gentle stretching or slow movement like Tai Chi or very gentle yoga stretches can support the healing of our immune system. Okay, but please don't overdo it. Now, N stands for nighttime routine and sleep. And within the Coronavirus Challenge, there's plenty of information, also within the Gupta Program, about how we can deepen our sleep. So if you have poor sleep, now's a good time to really replenish your sleep hygiene, replenish your sleep, go to bed earlier, don't use devices in the evening. As soon as you wake up, have exposure to daylight. All of these different tools and tricks can really help deepen your sleep and make your immune system more powerful. And you know, within the Coronavirus Challenge, we give you all the science. So when you do a particular video or a particular exercise, underneath it's lots of information about all the medical research studies which have shown the effect of that intervention. So for instance, people who have 8 hours of sleep, or 7.5 to 8 hours of sleep, they have 3 or 4 times less chance of getting a virus than somebody who has 6 to 6.5 hours sleep. Isn't that incredible? So the depth of your sleep and the longevity of your sleep are incredibly important for you to have a strong immune system. And finally, D for diet. There's plenty of things you can take to boost your immune system through your diets, which is once again explained in the Gupta Program and the Coronavirus Challenge. And one of the things I'd love for you to do is regularly take turmeric. So turmeric with a pinch of black pepper is regularly shown to boost the immune system, to act as an antiviral agent, to act as an anti-inflammatory, because we know an inflamed immune system, an inflamed body may actually increase our chances of these conditions. And turmeric is also known as an immunomodulator. So there's some evidence that it actually reduces pneumonia in rat studies and animal studies. And if there's any researchers out there or medical practitioners watching right now, we have a bias in the medical community which is focusing on researching drugs and medicines. But I implore those researchers out there to please go and research high-strength vitamin C, first of all. There is some evidence that certain doctors have used this. And secondly, turmeric, high-dose turmeric, 2 grams a day of turmeric with a pinch of black pepper and a soluble fat. If we were to give that to patients who are admitted into hospital with these conditions, what potential effect could it have? Now, we know that turmeric's pretty safe, and we also know that it does reduce inflammation in animal studies, and it reduces pneumonia in animal studies. So we should be testing this on patients right now. It's very, very safe herb. And let's see if we can inspire somebody to take that mantle on and test this in COVID-19 patients and see if this could genuinely be a miraculous intervention. And if you're out there and you are interested in doing this kind of medical study, then please do get in contact with our clinic. So in summary, if you know people who have the COVID-19 virus or who are recovering from it, very important that they deeply rest so that they make sure they don't go on to develop a more severe illness such as ME and chronic fatigue syndrome. And if you're already suffering from ME, fibro or some other chronic condition, please do take the Coronavirus Challenge, boost your immune system, or take the Gupta Program, which is obviously a more comprehensive program to help you retrain your brain out of these chronic conditions. And you can find that at www.guptaprogram.com. And you can use the code PEACE to get a 15% discount now as a result of the COVID-19 infection. So it's been wonderful to have you here with me today. So now we're going to go live on Facebook and Instagram for a Q&A on the same page that you're looking at right now. And if you can't find the feed, just keep refreshing the page until the video appears. So we'll join you in a few minutes' time. Thank you for watching, and keep safe and keep healthy. Thank you and goodbye.